Diabetic retinopathy. First questions. What retinal signs must we search for in diabetic patients? What retinal signs make us suspect that patient may have diabetes mellitus? That is to say, when we examine the patient by direct or indirect ophthalmoscopy, we can see some signs in the retina, and we should know what signs tell us that this patient has the diabetic retinopathy. But first of all, I want to talk briefly about the classification of diabetic retinopathy. There are two types of diabetic retinopathy: non-proliferative diabetic retinopathy and proliferative diabetic retinopathy. In NPDR, we can see microaneurysms, intraretinal hemorrhages, cotton-wool spots, hard exudates, edemas, in other words, intraretinal microvascular abnormalities, venous bleeding, and dilation. In PDR, we can see neovascularization and fibrous tissue. As the NPDR progresses, the retinal ischemia increases, and this leads to the development of new vessels on the disc and elsewhere in the retina. We also should know about the severe NPDR. There is a rule called 4-2-1 rule. Having any one of these features tell us that this is severe NPDR. Severe intraretinal hemorrhages and microaneurysms in 4 quadrants, definite venous bleeding in 2 or more quadrants, moderate edema in 1 or more quadrants. In these photos, we see mild NPDR. And we see hard exudates here, 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 and some dot hemorrhages. And we have here in this photo we see venous bleeding and edema. The photo on the right show us the fluorescent angiography photo, and we see edema. Edemas show us retinal ischemia, and they don't leak on fluorescent angiography. And this is an example of severe NPDR. In this photo, we see severe intraretinal hemorrhages in all 4 quadrants. And this is another example of NPDR. In this photo, we see hard exudates and some cotton-wool spots. The cotton-wool spots demonstrate the ischemia of retinal nerve fiber layer. Complications of NPDR are macular edema and macular ischemia. In this photo, we see macular edema. In diabetic retinopathy, the macular edema is cystoid macular edema and is best seen in OCT photos. In these photos, we see proliferative diabetic retinopathy. We see here neovascularization on the disc, neovascularization elsewhere in the retina, and we also see fibrous tissue on the area of the neovascularization and some hemorrhages around the neovascularization. And this is an example of neovascularization on the disc and peripapillary region. Complications of PDR are vitreous preretinal hemorrhages as we see in this photo, and tractional retinal detachment.